Hello and welcome to today's Indiana Human Services Mid-Session Legislative Update webinar on this March 1st, 2013. My name is Lucinda Nord and I'm with Indiana Association of United Ways, and we welcome you to this webinar with our partners, the Indiana Coalition for Human Services, and our statewide training partner, the Indiana Nonprofit Resource Network. If you have not done so already, please download the slides at www.inrn.org. There you will find some note-taking slides for those of you who like to take notes, as well as a 4-page healthcare options summary describing some of the issues that are facing our legislators this session. So without further ado, we will begin. What we're going to cover today includes a few items. One, very hot in the news, what's happening at the federal level with regard to sequestration and the possible impacts on Indiana. We'll give you a quick update around what bills are still alive, but really focus our attention on talking about those bills that affect the human service sector in Indiana in our General Assembly. We'll talk just briefly about how nonprofits may stay informed and influence policy in the coming weeks before the session ends at the end of April. And lastly, we'll take your questions through a Q&A section about the bills that you care about. So let's begin. In Congress, there are a number of things going on right now. If you recall, about 18 months ago, Congress couldn't reach agreement about how to deal with the deficit and the debt, and arranged this impossible task that Congress should come together and reach a compromise on spending cuts and possible tax increases before the end of 2012, or something called sequestration, or automatic across-the-board spending cuts would go into effect January 1st of 2013. Well, Congress didn't reach that deal by the end of 2012, and because January 1st is a holiday, they were actually able to reach a modest deal on New Year's Day that essentially kicked the can down the road just a little bit further, suggesting that they would have a little bit more time to come up with specific targeted cuts rather than the automatic cuts. As a part of that deal, we'll talk about both the charitable deductions and sequestration. So let's begin. So there's lots of talk right now about the charitable deduction. You may have read in some of the nonprofit news about what might be changing with regard to the charitable deduction. The January 1st deal did make a modest change to the charitable deduction for high-income earners, and that is that the value of their itemized deductions is going to be trimmed just slightly. And this is actually an old provision that was in place that was simply reinstated called the Peace Provision. However, that's not to say that the charitable deduction is out of the woods yet. The House Ways and Means Committee is really starting to look at the charitable deduction, and they had a full day of hearings on Valentine's Day to really look at, if we are going to do tax reform in the year 2013, where does the charitable deduction fit, and should it be changed at all? So some of those Valentine's Day discussions included conversations about caps. For example, should there be a limit to the amount that a person can deduct on their taxes from charitable deductions? Should there be a floor, meaning should there be a minimum amount that a person should have to contribute in order to take the deduction? And should there be any kind of limits on specific types of contributions that are questioned about what kind of value they really have? And those are contributions of cars and clothes and things that are not cash items. So while members of Congress really appreciate the value of charities in their districts and they see the importance of the charitable deduction, many members of Congress have stated very clearly that everything is on the table in terms of tax reform. So this is something that we will continue to monitor going forward. In terms of the sequestration or the automatic spending cuts at the federal level, it is to begin effective March 1st, but we really won't see the effects immediately because federal agencies have been preparing for this for some time by implementing hiring freezes, maybe suspending the letting of new contracts or new bids. and those federal agencies have been preparing for some of these cuts. There is still some debate about how much the cuts are going to be for this year, whether it's really going to be $42 billion of automatic spending cuts or $85 billion. Regardless, we know that it will have some impacts. Remember that sequestration does not affect entitlement programs, and entitlement programs are programs such as Medicaid, Medicare, SNAP, Pell Grants, Earned Income Tax Credit. None of those programs for the clients are directly affected. Now, Medicare does have a slight cut on the provider side, not on the patient side. So what we know is that we'll see this crisis come to a head once again toward the end of the month, trying to avert another government shutdown with regard to extension of the continuing resolution or the budget that we're currently operating on. There's a great debate over how to resolve this issue, whether we should have these automatic across-the-board cuts or whether the cuts should be more targeted toward programs that are viewed as less necessary or less effective. So the President is arguing for a balanced approach that includes both cuts and closing of loopholes. Congress is arguing for has a number of different groups that are arguing different items. Some are arguing for no cuts to defense. Others are arguing for cuts to entitlements. So the Congress is really divided and yet has not acted. So we will see this issue play itself out over the coming weeks and the coming months. And what we will really see in terms of sequestration will start to affect probably in April, where we will see the effects if Congress does not resolve this. So let's talk about the impact on Indiana. The document there listed at the bottom at whitehouse.gov is probably the best illustration that we can find to date of the possible impact on Indiana, of what kinds of cuts might affect Indiana in terms of education cuts, child care cuts, Head Start, senior nutrition, public health, employment and training through the Department of Workforce Development, and others. So there's a document there. This only lists just a handful of the cuts that are expected. Now, how the cuts will go into place really depends on the grant cycle and how the program is administered. As many of you know, some federally funded programs are administered directly, where the local organization receives a direct federal grant from Washington, D.C. Other federal programs are administered through the state, where the federal agency gives money to the state and then the state administers the program. So what we're hearing from federal agencies is the size and scope of the impacts really depends on where the program is in a grant cycle, how is it administered, and quite frankly, they haven't really figured out all of the impacts yet. So that's yet to come, but you are welcome to look at that fact sheet that gives a more explicit list. So now I'm going to turn it over to my co-chair with the Government Affairs Committee of the Indiana Coalition for Human Services, Mark St. John. So at this point, Mark will describe for you what's happening in our State House. Take it away, Mark.
All right, very quickly, again, this is the long session. They'll be here till April 29th. And the big issue, of course, is the state budget. That's about a $30 billion budget. And a reminder that this is a legislature that about roughly half of the people have 2 years or less experience. So this is a new issue to a lot of people. The next slide relates to hot issues here at the State House. And the slide is right behind me someplace here. It's coming.
I'm trying. There we go.
There we go. Again, the hot issues that we described them in January. It's been jobs, jobs, and jobs. It seems to drive a lot of everything. Lots of discussion, of course, about the budget that we'll talk more about in a moment. the implementation of the Affordable Care Act, possible Medicaid expansion, some more tweaking to education issues, and the Department of Family and Children. Next slide, please.
Okay.
On the budget, there's two budget proposals. The governor, which was interesting, that the Republicans control the whole legislature, but that they did not accept the Governor Pence's proposed budget. He called for a 1% funding increase for K through 12 tied to outcomes. The governor also asked for an increase of $6 billion for teacher excellence grants, fully funding full-day kindergarten, the creation of these workforce, Indiana Works Councils to promote workforce development, additional money for the Department of Child Services, and a big issue is cuts in state income tax credits by 10% over the next 2 years. The budget as it came out of the House, and you'll recall that the budget has to originate in the House, they asked for more money for education, a 3.3% increase for K through 12 with rewards for every year, fully funding kindergarten, but also asked for a $7 million pre-kindergarten pilot project. They've done $5 million more for the Department of Child Services to a total of $40 million. And they did not include the governor's proposed 10% tax cut, but they did expedite the inheritance tax phase-out that's going on. And while sometimes it's not a lot of money, it did increase funding for substance abuse services, for community mental health centers, for First Steps, and also more money for school social workers and such. So there's a lot of differences there. We're going to go on and talk about a little bit more of this. Here's some more detail about education. Lucinda.
Okay. Yes, before we get to that, could we launch our next poll, and that is to ask where most of the folks on this call would like us to focus our time. We have listed in each of the next sections some specific information about bills coming out from the education area, financial stability, child services, healthcare, and some others. If we focus any level of time, do you have a specific interest that you would like us to focus our time in talking about specific bills? Launch your response, and if you feel like we need to cover all of those, let us know, and that's where we will focus the bulk of our time. So as we run through the next slides, we're not going to discuss every single bill that's listed on those slides or that have been offered. Okay, well, it looks like our poll response, we have a fairly balanced. We want to cover most everything, but I think the two strongest were in the education and the healthcare area, so that we'll spend a little bit more time in those two areas. Great, thanks. So let's move on to our next slide, and that is in the education area. There are lots and lots of bills going through in education. From an Indiana United Way perspective, we are very passionate about the early education and quality child care area, and we are very pleased, extraordinarily pleased, that after years and years of trying, we leave the first half of the session with several bills passed in the child care quality area. There were two comprehensive criminal background check bills, House Bill 1194 and 114. There's a child care regulation bill, which is Senate Bill 305. There's a child care quality tax credit bill, which would provide very limited non-refundable tax credits. We were kind of disappointed with the way that the bill actually evolved and was amended, but it was the only way leaders said that they could get it passed through the budget, given the budget constraints. And then a pre-K pilot bill also passed out of the House, but it has met a little bit more resistance in the Senate. As Mark mentioned, full-day kindergarten is finally fully funded, which is pretty exciting because it has been grant funded to date. In the education reform area, there was a continued aggressive approach in education reform, although I have to tell you that there is a sort of education reform fatigue among certain legislators. So what we have seen is a voucher expansion in House Bill 1003, which increases the number of people who would be eligible, students who would be eligible for the school choice voucher. There's a Common Core bill. There's an absenteeism bill that helps define what absenteeism is and how that has to be recorded by schools. There's a remediation bill that really tries to look at making sure that students do not leave high school needing remediation as they go on to college. The Various Education Matters bill is sort of a stockpot of all different kinds of issues, including a deduction for teacher supplies, as well as the very controversial requirement that schools are no longer permitted to collect teacher union dues that are associated with political activity. They can still collect teacher union dues, but nothing going toward political activity through payroll deduction. And that's one that there were a number of these bills that went through various iterations on the last 2 days of the first half of the session, and some of those bills were not uniformly supported, whereas a number of other bills really try to reach consensus, and it's not uncommon at all for a number of bills to pass with 90 votes in the House or with 40-something votes in the Senate, but a number of these education reform bills that have been sort of hotly debated in the press did not have the kind of full support. We also saw a number of other bills around safety of children in terms of school employee background checks. The school resource officer bill would actually put money behind the addition of school resource officers. These are actual law enforcement officers who have additional training to work in school districts. There's some question in the field, so education and child advocates are a little concerned about putting more school law enforcement personnel in schools when at the same time that we're not putting more social workers or counselors. So I know from a child advocacy community perspective there are concerns. While they welcome the idea of more support in this area in schools, they might be a little concerned about the sort of criminalizing behaviors when kids just need help. The in-state tuition for certain college students, that's resolving a problem that was created for college students who are in college without legal status. All of those students a couple years ago were forced to pay out-of-state tuition or to drop out of school. This bill just creates, sort of reverses that just for those students, not beyond for all deferred action students or all dreamers. And then finally, there were a couple other bills that were high profile, the cursive writing bill and the anti-bullying bill, which I know a lot of our child advocacy colleagues really worked hard on the anti-bullying bill. Oops. In the health area, the big issue is about how Indiana will implement the Affordable Care Act. And so there were a number of bills. There was actually both a Senate bill and a House bill about this issue of expanding coverage to the uninsured. The House bill died, but the Senate bill is going to be the vehicle bill for this activity, and that's really going back to this question of, the questions that each state has to answer are first whether or not to set up its own exchange, and Indiana has declined to set up our own exchange to date. We could change our mind. in the future, but there's a bill that actually puts some parameters around the exchange and sort of retains state authority over the insurance providers who operate on whatever exchange we end up using. And then the second question is what kind of health benefits are going to be offered on that exchange, and that decision basically has already been made for a sort of standard Anthem plan. And then the third big decision is really whether or not and how to expand Medicaid. With the Supreme Court decision last summer, states are permitted to opt out of the Medicaid expansion, and basically that big question is related to that 4-page document that we also provided for you through an upload. And the healthcare options really goes into this question of whether or not, so there are really 3 options that we have. We can choose to do nothing as a state. There are, we can choose to expand Medicaid per the ACA, or we can choose to, as we have, the governor and legislative leaders have expressed a preference to use HIP, the Healthy Indiana Plan, as the vehicle for expansion. So with that, there has been a proposal submitted to the Center for Medicare and Medicaid Services. That proposal has not been acted upon, and there are some questions about whether or not CMS would even approve that. So we offer to you that 4-page document that really summarizes what those 3 options are, what they cost, what are the features of each option, and the pros and cons. So I'll leave that there, and if we need to go back to questions, we can. There are a number of other healthcare issues, both in the budget and then individual standalone bills around school health clinics, immunizations being allowed by pharmacists, something that a lot of nonprofits that engage in after-school work and activities, concussions in youth athletics was a big issue and will continue to move forward. And then those who are worried about some of the family planning options are aware that there are a couple of bills around abortion. So let's move on. Those are the healthcare issues. I'm going to turn it back to Mark to have him talk a little bit about some of the financial stability bills.
There were several things that relate to financial stability that have moved the first half of the session. I want to talk about the SNAP benefit issuances. It's designed to be a schedule change to, in theory, will spread this out throughout most of the year. And I had to figure out how to make my phone not work. Hang on.
So with the SNAP benefit issuance, what it does is it basically changes from a 5-day period of issuing SNAP to a almost a 15-day period from the 5th to the 23rd of the month. And that allows the benefits to be distributed throughout the month so that it really minimizes that burden on retailers, that they feel that, you know, everyone who receives a Social Security check gets it in those first days of the month and was getting SNAP in the first days of the month, and now it's spread out. And what we'll also hopefully do is spread out the impact on food pantries, because as a lot of food pantries know, they get slammed toward the end of the month, and now people will be on more of a rolling cycle. So Mark, take it back.
And I apologize, it's a new phone and I don't know how to work it all yet. Another bill was Senate Bill 559, fraud. The bill has a premise that most fraud in Medicaid or TANF or other things is generated by the recipient as opposed to the provider. And this is on an effort by Senator Brent Hirschman to address some of those issues. There are acceptable things in the budget. There are some troublesome things in that bill, and there's some troublesome things, and we're continuing to work with it. Another that has been high profile has been drug testing for benefits, House Bill 1483. This is aimed at people that receive benefits through the TANF program, and it's calling at this is similar to a bill that was considered last year, but this year it calls for people to be assessed about their propensity for addictive behavior. Again, there are some significant concerns about the bill, and the Coalition for Human Services is working with senators as that bill moves over to try to address those concerns. Several of you may be familiar with the individual development accounts, a sheltered savings program for people that funds are matched by state dollars or federal dollars and can be used for purchase of a home, down payment on a home, repairs, going to school, starting a small business. That has had a state appropriation for several years of $1 million a year. It was cut in half to $500,000. Again, we're working to try to restore that at a minimum, restore the $1 million appropriation. There's been continual attacks in the past on the earned income tax credit, the state earned income tax credit. We've monitored closely for that, and nothing's happened so far, but we've got another 60 days to watch here. Another item that's been discussed is in Senate Bill 418, financial literacy in schools. Certainly there are concerns there about kids that are coming through school and understanding that financial is more than just balancing your checkbook, about budgeting, planning, and stuff. The bill has passed the Senate and stands a good shot at passage in the House. There's certainly other kinds of priorities about affordable housing, utility rates, things about streamlining eligibility benefits and such that are continuing to be monitored by both the Coalition for Human Services and the Indiana Association of United Ways. Next slide, please.
All right. So I know that we have mentioned and pushed this out both through our newsletter and through the ICHS newsletter, but we just want to remind you that we created a guide to safety net programs, and we encourage folks to download that, or if you would like copies, it just gives you a quick overview of how many people rely on TANF or SNAP or CCDF and the like. So we'll just whip through a couple last slides and then get to our question and answer, because I know that lots of folks have questions and we haven't been able to get to those. So we will open that up shortly. So in the child services area, there were a whole package of bills that came out of the summer study committees last year. And in the last weeks of the session, in the House side, they actually combined a number of the bills together. So where, if you've been following DCS bills, there were a number of bills that were combined into 1123 about 2 weeks ago. But essentially what they're looking at doing are adding new staff on the hotline, adding lots of new caseworkers and supervisors, putting some different processes in for handling reports and identifying who's a mandatory reporter. Not that everyone isn't a mandatory reporter, because as we all know in human services, if you're aware of child abuse or suspect child abuse or neglect, everyone has a responsibility to report. But those certain mandatory reporters like social workers and counselors and school teachers, those folks will actually have sort of a direct line to the DCS office and the supervisor, whereas before they had to go through the centralized hotline. There is the whole Chin 6 issue that was hotly discussed last year. The Chin 6 is that process of where children who are in need of services because of behavioral or emotional issues, where their parents were turning themselves in for abuse, that process of has been updated and reformed. There's been a new Child Services Oversight Commission. There were actually three different bills around commissions, and then the child fatality reviews. Again, all of these came out of the DCS study committee last year. Then we have a couple of other bills that have been hot around child services issues, around school discipline, around gangs. There's a new sort of a child protection registry, somewhat similar to the do not call list, but for kids. A lot of attention on children this particular session. Then in the strong communities area, there's just a couple key pieces. We won't go through all of these, but Mark, if you could just give us the 10-second update on the transit.
The transit option is the bill being considered in Central Indiana to expand out the funding available and to create the ability to expand public transit in Marion and Hamilton County and surrounding counties. The bill passed out of the House. It's not perfect, but it's passed out of the House. And the issue for people outside of the greater Indianapolis area is this may set a precedent for future public transit funding. I also want to talk about really the I'm happy for the 211 network, that after years and years and years of trying, they finally got some money in the budget to help fund a portion of the 211 network. And I know that several of you are engaged with that, or certainly all of you make use of that. There's been other issues about firearms and weapons and livable communities. There is an issue they're proposing to up the registration fees for lobbying. Fees have not been upgraded for a couple of decades here. It does take, if you have to register as a lobbying for non-profit organizations, it moves the registration fee to $50 to $100. A percentage-wise large fee, but again, it's been more than 2 decades since that's been fussed with. So just to alert you to that.
Right.
Next slide, Linda.
Yes, and before we move from that, we are working behind the scenes on that, because as many of you I know have attended our nonprofit advocacy training where we talk about to register or not register as a nonprofit. And what we have talked with a number of legislators about is the option to, right now, if they move this registration fee, the fees themselves will be 40% of the lobbying threshold for nonprofits. So we are asking that either the threshold be increased or that lobby registration fees be excluded from the threshold, because that really goes to the point of how many hours do each of you as nonprofit executives and professionals spend lobbying. And we will keep you posted on that. So just wanted to highlight a few of the sites that we have referenced. One new site that we didn't have available the last time we had a webinar at the beginning of the session is the Cover Indiana Medicaid Expansion website, where you can find a lot of material about Medicaid expansion, in addition to that 4-page summary that we provided with that's more of a just the facts kind of summary. The Cover Indiana group is really a campaign that's working to expand Medicaid to really make sure that that's a quality option. Then lastly, we have a number of helpful websites that have been that might help you with lobby registration or Congress or the State House. I'm going to fly through very quickly just a couple slides, and many of you have seen these before because we want to get to question and answer. Just the quick and dirty is that if you have heard from a board member or a staff member that nonprofits aren't allowed to lobby, I'm here to tell you that nonprofits are allowed to lobby, you are allowed to advocate, and you are allowed to educate. We strongly encourage you to do all of the above. There are some exclusions depending upon what kind of funding you receive or what kind of organization you work in. The key is to know the rules, and wherever possible, have your board members and volunteers tell the story, because that does not have to get tracked. Nonprofits are allowed to engage in the full range of activities to help influence legislation, administrative policy, or rules. To get started, you really want to think about what is the connection between the programs that you're running, the people that you're serving, and the policies that are affecting those programs and the people you serve. You might want to identify some key people in your organization that can help you advocate, and then figure out what kind of role your organization would want to take. And we have a whole advocacy session that we could spend with you, but I know that many of you signed on today because you're interested in learning about specific bills or what you can do about those specific bills. So with regard to what you can do, let's pull up our next poll really quickly, and that is specific to the question of, have you attended a third house session before? Let's find out from our group whether this group has attended a third house session. So yes, you attend when you're able. You attended some in the past, or you attended one in the past. No, you don't attend them. Or what the heck is a third house session anyway? Let's see how our folks respond to this poll and find out, because this is one of the key ways that you can get involved at the local level. While you're pulling up that poll, I'm going to flip over and show you a third house list. So it looks like, oh my gosh, no, we have a lot of folks who haven't attended or don't know what it is. So this is our website at iauw.org. I'm going to click through and you can see a third house list. Third house is sort of the catchy name. Sometimes they call them Cracker Barrel sessions because they're actually held in the back of a Cracker Barrel restaurant, or a Meet Your Legislator meeting. And you can see here we try to post every week the updated list of third house sessions, and we have a number of those going on around the state. Sometimes you have to register in advance, sometimes you can just show up. So we encourage you to take advantage of the third house session that's in your district. So Mark, do you want to talk a little bit else very quickly about what else folks can do?
Let's go to questions.
Okay. All right, so here are some other things you can do. I'm not going to, let's just skip through these. I see a whole list of questions. You see some of the slides. Hopefully you've been able to print those out. And let's go to question and answer. So let me go back. I'm going to go back. I apologize. So starting with some of the questions, I see, I'm going to read some of the questions that we've already seen. One is, what about people with disabilities? I'm not sure what the question is, but one bill that we're aware of that relates to people with disabilities is the seclusion and restraints in school bill that we know our friends at the ARC have been very interested in, and that's to really help ensure that schools are using appropriate kinds of practices and not as some of the practices that you've seen in the media with some of the higher profile cases where children, especially kids with autism and behavioral issues, are not treated appropriately. I'm not sure if you have any other question, Dan, about people with disabilities, but that's one bill that we know has been followed. There's a question about how the 184, I'm not familiar with Bill 184, and 338, that is the absenteeism bill. The chronic school absenteeism bill, which is Senate Bill 338, requires the Department of Education to provide some resources and guidance around practices around chronic absenteeism and habitually truant school students. They require them to define it in a particular way and then to report it in a particular way. And I'm not as familiar with that particular bill, but that's what I know. Let's see. Are those creating the state budget considering federal cuts? I'm not aware that they are. To my participation or observance of the budget process to date, I have not seen them pay a lot of attention to what might be coming in terms of sequestration. I know that previously legislators have made the case that they don't intend to make up the difference between the federal cuts and the state cuts. I believe that currently we get about 26% of our total spending from the federal government. I don't know, Mark, if you know a different number than that, but I think
that's my understanding.
So,
by the way, Senate Bill 184 is about the choice scholarship eligibility here.
Okay.
And that language was placed into a House bill, as I recall, but it's still up for consideration. There's still some weighing about what would be the financial cost to both the state and local school corporations. So I think that issue is still kind of up in the air.
Okay. Then our next question comes from Dana and asks, can you talk a little bit about individuals with disabilities, about how they are affected by the sequester and by Medicaid? So I can't speak specifically to the issue of how individuals with disabilities will be affected. There are a number of programs that currently serve people with disabilities, particularly the educational programs in schools, kids who are on IDEAs, the teacher aides that are provided in schools. A number of those kinds of positions and programs are actually a part of the sequester. So those can expect cuts, anywhere between 3 to 8%. How those will be cut and when they'll be cut, I'm not sure. With regard to Medicaid, Medicaid is an entitlement program, so the individual who receives Medicaid should not, to my knowledge, should not feel a direct impact. The indirect impact could be that because there are going to be cuts, not related to the sequester, but because the state has issued or is considering additional cuts to provider rates, what we could see is a reduction in the number of individuals who accept Medicaid, individual providers or physicians. Mark, I don't know if you have any other comments.
That would be pretty well it here. I do know that ARC and NARF and other groups are closely monitoring this whole issue about the Medicaid expansion to make sure that that there's no adverse effects that happen inadvertently if the state expands Medicaid for people with disabilities.
Okay, and then I am not seeing any other questions. Let's try this. We've never done it before, but let's try to unmute everyone, which means that if you have microphones on your computer, we will be able to hear what's in your office.
I think you better do your back.
Oh, that's terrible, isn't it? Okay, we tried. So if you have a question, please submit it through the chat box. That's the best way.
I used to do that, but then I was the
Oh, I'm hearing other folks. So if you have a question, please feel free to ask your question now.
You can't do that best. You got to step away from it, and sometimes you have to cut the fucker loose. And that stinks, but it doesn't, because if you operate with the reality that
Okay, Lisa, we might need you to... Okay, we apologize for that. That was our first experiment with trying to open it up to everyone. I'm not seeing any other questions. Pardon me?
So perhaps our last experiment with that.
Yes, we are very sorry for any of the technical issues that we have had during this webinar. So before we leave this particular page, I'm going to just ask our last poll question, since I don't see any other questions waiting for us. If we could bring up the last poll question with regard to health care, and this is through the Cover Indiana group, which is actually meeting right now. This is the group that's collecting stories. What we'd like to do is to see if we could bring up that last poll question. Specific to healthcare, do you have clients or who would be willing to share their stories either on a postcard or in a letter, or to tell you their story where you as a service provider could share it with Cover Indiana campaign, or even have them come to speak publicly? So we're taking your poll because Cover Indiana is actively soliciting stories from folks who maybe can't afford insurance, don't have access to insurance through their employer, don't have access to insurance because of a job loss, and we're trying to find folks who may have had some financial problems because of medical bills. So let's see what our poll results show. So it looks like most of our folks I can't read the percentages, but it looks like we have a lot of folks who either don't have them or don't have access to clients in that way, or aren't sure about it. But we just want to let you know that there is an opportunity for clients to share their stories, and we are looking for, the Cover Indiana campaign rather, is looking for organizations who are willing to help collect those stories. So thank you for participating in that poll. So lastly, we'll go back through our slides. I'm looking to see if there are any other questions before we bring this. So we do have one who's willing to speak publicly. That's wonderful. Thank you. So we have a couple people who've responded to that, and we appreciate. If you do have a client or maybe even a staff member, because maybe some of your organizations can't afford to pay insurance, and folks who earn incomes up to 138% of poverty could be eligible for whatever this expansion option might be, and then folks between 100% of poverty to 400% of poverty would be eligible for the subsidies to purchase insurance on the health insurance exchange. So we're trying to help create that bank of stories and to understand the issue so that we can really design the best system that works for Indiana as we talk with policymakers. So I'm not seeing any other questions. Last chance, if you have a question, submit it via the text. And if not, what we'd like to do is, first of all, apologize for all of the technical issues on this particular webinar. We didn't have as many for the last time, and we promise we won't have as many. We'll try not to have as many for the next webinar. We thank you for taking your time out of your busy Friday to get a quick update. We do post the information both on the INRN, that's the Nonprofit Resource Network training organization's website, as well as IAUW and ICHS, a lot of acronyms there. But on behalf of all three organizations, we really thank you for what you're doing. We know that this is a difficult time to be working with the uncertainty related to the budget, particularly if you receive any federal funds, and the uncertainty that we have with just this economic recovery. So we so appreciate what you're doing for people who need help, need just a little lift up, and sometimes need ongoing support. So Mark, do you have anything to add before we close up?
Just thank you for being with us, and we hope to do something right at the end of the legislative session, right following the end here in after April 29th.
Yes. Great. So we look forward to talking with you again. Thank you so much, and we look forward to talking with you through our newsletters. We welcome your feedback. There is a survey that will be added at the end of this webinar when you close it. So thank you again, and have a wonderful week.